Now, NHS waiting lists could top 8 million by next year. That is the stark warning in a new report from the Health Foundation. The government has blamed strike action by junior doctors and consultants for the rise, but today's report shows the walkouts have had a minimal effect on those waiting for an operation.
Well, joining us now is former NHS Trust Chair Roy Lilley. Roy, really good to talk to you again. Let's start looking at this report. What do you make of the analysis that waiting lists are approaching 8 million? You and I have spoken about this a great deal. Obviously, we've been hit by the strikes, by the juniors, by the senior doctors. Your thoughts?
Well, look, the Health Foundation is a highly respected organisation, and it's difficult to challenge the report because they've done the report on their own terms. They've created 3 scenarios and they've said, what if? But to be honest, I think that this is in the sort of, if pigs could fly, bacon would be a lot more expensive department, really, because the scenarios propose certain things might happen. If this happens, then that will happen. If this happens, that will happen. And so one of the scenarios is that the strikes continue. There is no acceleration in the NHS performance, and we get to the 8 million. Now, I remember talking to you last week where I said I thought the waiting list numbers would get to 8 million anyway. And of course, the big question, the elephant in the room question is, are the strikes making a difference? Well, they seem to be concluding that the strikes are distorting the numbers by about 3%, which is not a big number. However, 3% of a big number is a big number. So we're looking at probably 250,000 people who've been turfed off the list and are somewhere in some kind of no man's land waiting to get back on the list. So I think the 2 things about the report. Firstly, we need to be very wary that these are mathematical scenarios and it's not based on fact, because no one's Mystic Meg and we don't know what is going to happen. So it's what if. And secondly, the strikes are having effect, and we shouldn't be confused by the fact that the percentage is a small number, because it's a small number of nearly 8 million.
What we do know, Roy, is that if you're a patient, this really, really hurts. A patient waiting for a diagnosis, waiting for treatment. This is not good at all.
No, you're absolutely right. And the report is at pains to make that point. They say behind every number, there's a person who's waiting for a diagnosis. I mean, I don't want to get into the weeds of this because it's too early in the morning, but these numbers are based on what's called completed pathways. So you go to your GP, he says, well, I don't know what's wrong with you, I'm going to refer you to hospital and say you're on the waiting list for, say, a diagnostic. Now, about 60% of people on the waiting list are waiting for a diagnostic. Of those, only 20% will need a period of inpatient treatment. That you're going for a hip or a knee, or what we call an elective procedure, a non-emergency procedure. Now, the question really then is, okay, when there are delays in these patient pathways, what happens? Well, there's precious little research, but we can use our common sense and we can say people are not on a waiting list for fun. They got to the front of the queue because of their clinical need. If they get turfed off of the waiting list because of the strikes, their clinical need will what? Well, will it get better or worse? Well, common sense said it will exacerbate, it will get worse. So it's highly likely that the people who started out with a fairly benign patient pathway that could be dealt with fairly simply, a percentage of them will end up with something far more sinister. And here, we're talking about cancer, we're talking about heart disease, COPD. I mean, David knows well, how these things can suddenly accelerate if you don't nip them in the bud. So yes, you're absolutely right. Behind every number, there's a person, and people watching this program this morning who know somebody on the list, or perhaps are on the list themselves, will be very worried to know what is going to happen.
And that's right, Roy. It's the lived experience, isn't it? The report goes on to say more than 1 million appointments and procedures have been rescheduled. In terms of people's expectation of the NHS, satisfaction in the NHS at an all-time low. I mentioned earlier that we believe the waiting lists are actually higher than 8 million. And that's because it doesn't take into account the onward care waiting. So if you are waiting for that initial assessment by a specialist, that's one thing. Once you've been seen by a specialist, you could then be on a secondary waiting list.
Yes, you go into a sort of a black hole after that. So the consultant says, okay, you need some tests and what have you, say, do the tests, and then you go home, and then what? And I was talking to some practice managers, GP practices, the other day, and they were saying, one of them said 23%, they did an analysis, 23% of their time in primary care is taken up with sorting out inquiries from people who've been to hospital, had a test, seen somebody, and are now waiting to know, well, what happens? What's going to happen to me? And there's a huge amount of time being wasted in primary care, chasing up, saying, you know, Mr. Lilley came and had his diagnostic, you know, what's next? And there's a big delay. There's a kind of electronic black hole where people sit. So you're quite right to point that out. And the other issue for me as well is they don't, excuse me, they don't discriminate in these numbers between people who want a diagnostic and people who want treatment. And I think we need to start unpicking that. I mean, I've done the sort of back of the envelope numbers, and it looks to me like 60% of people are on there for a diagnostic. If we and I think the NHS know that, because they put a lot of money into setting up new diagnostic hubs. There are 14 of them opened recently. There's a big pressure now on getting the diagnostics done. The problem is we don't have enough diagnostic radiographers to read some of this stuff, and a lot of it now is depending on machine learning to compare images and to crack people through the system quicker. I think the handle on this that I would do is I would go all out on diagnostics, because I know I could knock a lot of people off the waiting list if we get the diagnostics right.
Roy, just a final thought from you. We've talked about the strikes, COVID also a factor cited by the government, increasing the backlogs, although we know that those waiting lists were a problem long before this. What kind of radical thinking is it going to take to get through these waiting lists?
Well, I mean, we've got to fix the strikes. That's the first thing. Although they're downplaying the effect of the strike, it's having a big effect on morale. It's having a big effect on management. It's taking a huge amount of time to sort it out. They've got to do the strikes. Now, the consultants look to me like they've read the room and they realise that they won't have public support earning that kind of money and going on strike. So they've been desperate to get back into talks with the government. The government have been talking to the consultants this week. There are rumours that the junior doctors are having lower level management talks with the Department of Health, not with the politicians. So, I mean, I think there are talks underway. We will know soon, because if the junior doctors or the senior doctors go on strike, they have to give a 14-day notice. If they're going to strike in November, then they need to tell us probably by, well, certainly the weekend, I think, next weekend maybe. So we'll know that. But the key to this is to stop the strikes and give the NHS a clear run at it so it can roll up its sleeves and get it done.
Roy, I'm sorry to cut you off. We are running out of time, but thank you very much.